stop. If you or someone you know is suffering from the painful infestation of jiggers, you might feel desperate. You've probably been told to dig them out with a non-sterile tool like a needle or a pin. This is the single most dangerous thing you can do. It's a widespread myth with devastating consequences. Using unsterilized tools can lead to life-threatening infections like tetanus, gangrene, and even amputation. But there is a better way. In this video, we'll show you the safe, sterile, step-by-step process used by medical professionals to treat jiggers effectively. Stick with us. It's easier than you think and ensures a safe recovery. First, to properly treat them, let's understand what a jigger really is. First, understand your enemy. This is a jigger or sand flea. The female burrows into your skin to lay eggs. The swollen white bump? That's her rear end, full of eggs. Puncturing that sac with a non-sterile tool spreads eggs and bacteria, creating massive infection. Next, we'll show the safe, sterile method used by professionals, step by step. You will need sterilized tools like a needle or tweezers, boiled for 5 minutes plus antiseptic, ointment, and bandages. Having everything ready prevents cross-contamination. Wash your hands thoroughly and put on gloves. Sterility is a non-negotiable step to prevent secondary infections. Step 1. Soak the affected area in warm, soapy water for 10-15 minutes. This crucial step softens the skin, making extraction less traumatic, easier, and safer. Step 2. Sterilize your tool by boiling for 5 minutes or soaking in alcohol. Then, clean the skin around the jigger with antiseptic. A clean field prevents pushing bacteria into the wound. Step 3. This is crucial. Do not stab or squeeze the white sac as this can release eggs. Use the tip to gently loosen skin around the breathing hole. With good lighting, apply very light pressure and pry the flea out intact. The goal is complete removal. If the sac breaks, don't panic. Carefully remove any visible parts of the flea and egg sac, and then disinfect aggressively. Step 4. Immediately flood the open wound with antiseptic. This is critical to kill remaining bacteria and prevent infection from setting in. Apply a layer of antibiotic ointment and cover the wound completely with a sterile bandage. Step 5. Monitor the wound. Change the bandage daily and reapply ointment until the skin is fully closed and healed. If you see increased redness, swelling, pus, or develop a fever, see a doctor immediately. You may need antibiotics or a tetanus shot. Remember the 5 key steps: soak, sterilize, extract, disinfect, monitor. Following them carefully ensures a safe recovery. Removal is only half the battle. To truly win, prevention is everything. Simple daily habits are your best defense. Always wear closed-toe shoes outdoors. Wash your feet with soap and water every day, especially after walking in soil, and be sure to dry them thoroughly. Keep your living spaces clean. Regularly sweep and plaster floors to seal cracks where fleas hide and lay their eggs. This is key to breaking the cycle of infestation for good. Dealing with jiggers is painful, but doing it safely protects you from far worse dangers like tetanus and other severe infections. If this guide helped you, please like and share it. Spreading this knowledge helps protect entire communities. Subscribe for more practical health guides. Stay safe and thank you for watching.